Okay. About the survey then, so just for a bit of context about the survey, and I know some of you may be more familiar with the survey than others, but just a couple of key points here. So the Under 16 Cancer Patient Experience Survey was developed and is implemented by PICA on behalf of NHS England and Improvement. The aim of the survey is to really understand the experiences of cancer care in children and their parents, so those aged under 16 and their parents across England. And this is to help understand what care looks like both nationally across England and locally at PTC or Principal Treatment Centre level. The survey is supported by a really engaged group of expert stakeholders. We've got clinicians, patients, charities, to name but a few, who sit on that meeting advisory group. And we meet at least quarterly to discuss the methodology and the survey process. It's a mixed mode survey, so those who receive the survey will have the chance to either complete a paper version or to go online and complete an online version. The survey first ran last year, so it's a new survey, and we published results in October 2021, and those are available on the survey website. And what the survey asks about is really the whole cancer care pathway, from diagnosis, communication about care and treatment, respect and dignity, information, care people receive in hospital, care people receive at home. There's 3 survey versions, one for 0 to 7-year-olds, which is aimed at parents, and then there's 2 children's versions, one for 8 to 11-year-olds and one for 12 to 15-year-olds. The 2 children's versions each have a section for children to answer and for their parents to answer. And for any further detail, there is a survey website where you can find lots more info about the survey. This is just a couple of screenshots from the survey, so you can see what it looks like. So very sort of colourful and lots of pictures to engage children. A couple of important points before we get into the sampling process, which might be sort of some of the questions that people on this call have. So national data opt-out. So the national data opt-out is a service that allows patients to opt out of their confidential patient information being used for research and planning purposes. It's important to note that this survey, the Under 16 CPES survey, is exempt from the national data opt-out for the first 2 years. So this is the 2nd year. What that means is that all eligible patients are to be included in your patient samples unless otherwise stated. Patients do not have to actively consent to the sharing of their data. So different opt-out mechanisms exist for this survey, which I will touch upon in a moment. And again, you've got the link there, which lists the exemption of this survey from the data opt-out. Another important point to mention is Section 251. So this survey has received Section 251 approval from the Research Authority's Confidentiality Advisory Group and the Secretary of State for Health. What this means is this allows for the confidential or sort of patient mailing details to be passed on to PICA for the purpose of conducting the survey. So we have that consent and those approvals in place. And again, details can be seen on the CAG website and on the Under 16 CPES website, the various approvals. What does Section 251 mean? It's really, really important that we adhere to the information we put on the Section 251 form and the approvals we've got in place. Some key points are as follows. So for trusts, for NHS trusts, this means that you must not submit any additional data other than what we request in the sampling information and guidance. It means that trusts must ensure they have removed patients that have specifically opted out from this survey via the dissent posters. I'll be saying a little bit more about that in a moment, but you should have all received these dissent posters and be displaying them. And trusts should submit their patient list using only PICA's secure online platform site, which we will send you the details of once your sample forms are ready and complete. And I'll come on to that a little bit later. what Section 251 means for PICA for us. So we have to keep patient information confidential. We have to check for deceased patients prior to each of the 3 survey mailings by submitting to the list to DVS. We must remove patients that opt out via our free phone helpline or via email or via returning a blank questionnaire. So those are the opt-out mechanisms that patients have during fieldwork. We check free text comments, so the open-ended questions during fieldwork for any safeguarding concerns that arise. And we securely delete patient identifiable info, so names, addresses, by 12 months after publication of results. So they're the sort of formalities and approvals required for this survey. For those of you, many of you would have been involved in the sampling process for the under 16 CPAIR survey last year, and I just wanted to highlight 2 of the key changes this year that you will notice as you look through the sampling instructions and listen to today's webinar. So ICD-03 codes have been added as a variable. So you will not only need to provide ICD-10 or 11 codes, but also ICD-03 codes. The reason for this is that we want to improve how we report by diagnostic group. So when we got to reporting last year, we had a reporting subgroup set up who advised us on the reporting, and it came to light that it would be more beneficial to use these codes to create the diagnostic or cancer groupings for the reporting. So we are collecting those this year. The way you submit your sample is also changing. So last year you would have been submitting via our FTP, our secure file transfer site. This year we're moving to a new secure sample checking platform. You actually submit it via our online platform, you upload it. And the benefit of this is it allows automatic checks, and it will allow you to instantly see where there may be problems or errors in your file. And Philippa will be talking through that process in a bit more detail later on. The online sample checking platform is the same as we use across other surveys, for example, adult CPAIR survey, so that for those of you who might be involved in those surveys, it will be the same platform. Okay. I'm just going to pause, check in with Philippa if there are any questions before I start talking through compiling patient sample.
I can't see any at the moment, Amy.
Okay, thank you. Okay. So compiling your sample, so what does the process look like? So all trusts will need to compile a list of eligible patients. They'll need to perform checks on the sample. Those checks are outlined in detail in the sampling guidance. Remove deceased patients by conducting DBS or equivalent checks. Create your one file containing all of the required data. Before you submit that to us, you must submit a data sharing agreement and a patient list declaration form. I'll talk about the purposes of those 2 forms shortly. Once we've reviewed those forms, we accept them, and then we'll release instructions for submitting your sample via the online platform. This final point's an important point. The person who compiles the patient sample needs to be available for up to 2 weeks after they submit the data, or have somebody else available who can answer questions or potentially redraw the sample if any significant problems are highlighted. And we've had instances in the past where we have had a sample submitted and then somebody's on leave for a couple of weeks, and it hugely delays the process. So that's just important to highlight there. Okay, what you will need. So on the survey website, the link at the top here, this will take you to this is the main survey website link. This exact link will take you to the survey support materials page. This is a really useful page actually, because it's, if anybody wants more information, general background information about the survey, you've got the survey handbook, and I advise you to take a look at that or share it with anybody in your trust who asks for more information. These 2 documents here are key, the sampling documents. So you've got the sampling instructions, and you've got the sample patient list spreadsheet. So the instructions is a PDF document which informs you how to compile your sample, and the sample list spreadsheet gives a download for an Excel file, which you submit your file in, your patient list in. So sample guidance and Excel template, as I just mentioned on the previous slide, available for download from the website. These two documents here are also important ones. So these are the two forms that you need to complete before you submit your sample file. The data sharing agreement, the purpose of that is to ensure you have the relevant permissions for data leaving your trust. The sign-off level is up to you, but it's usually the Caldecott Guardian or Chief Exec that does that sign off there. Philippa will have emailed the form to you. If you haven't got it or need a copy, do let us know. We'll be sharing email address at the end of this presentation. And just to reiterate, the data sharing agreement, you can complete that now. You can submit that now. You don't need to have your sample drawn and ready. You can get those permissions as soon as possible. And we already have one from OneTrust, so thank you. The declaration form, the purpose of that is to ensure the samplers have been drawn as per the guidance and that all necessary checks have been completed. It also confirms who drew the sample, so picker know who to contact with any queries about the sample. You do need to wait until your sample is ready to go before submitting that, because you will need to confirm various details about how you've drawn the sample and that you've done it in the right way. Again, those can be emailed. Those two forms can be emailed to picker, and only once those two forms have been reviewed, approved, and signed off, we will be releasing the instructions to upload your sample. I'm just going to run through a couple of slides with some key inclusion and exclusion criteria for who to include and not include in the survey sample. To reiterate, this is all included in the sampling instructions in detail, so do take a look at that. So to summarise, all children aged under 16 at the time of their cancer care who have been discharged for cancer or cancer-related care or treatment between January the 1st and December the 31st, 2021 should be included. So the sampling period is a full 12 months of the last calendar year. Those with a confirmed primary diagnosis of cancer or some specified non-malignant brain, other central nervous system or intracranial tumours. And these are defined by ICD-10 or 11 codes. Again, those are all detailed in the sampling instructions. This is an important point here around the primary cancer. So it should be defined as the main diagnosis shown on your system, regardless of how many times a patient has had cancer in the past or how progressive their cancer is. And it should include inpatients and day case admissions and not outpatients. And again, I'm not going to go through this, but this is just an extract from the sampling instructions where you can see exactly what codes, for example, what ICD-10 codes are eligible for inclusion. A couple of really important points are as follows. So only patients that are seen by cancer teams should be included in your sample. So some patients might be seen occasionally by other sort of non-cancer teams. So those can be taken out, those records can be taken out, but keep the records in which are seen by cancer teams. Hugely important that patients are aware of their diagnosis. We don't want to be sending a questionnaire to a parent who's not yet had a formal diagnosis. That is likely to be a manual check. That is likely to require a cancer team member checking your patient list, patient by patient, to ensure they are aware. And another important point is that duplicate patients are not removed. So it's very likely that a child has been seen more than once at your trust within the year 2021. So what it's likely to mean is that your file includes multiple rows for a given patient. Please include them all eligible instances of care. Parent mobile phone number and email address should be included. Now, we asked for these details last year, and we found that in many trust files, the data was either incomplete or absent. If it's available, please include it. And the reason for including it is that we're exploring how we might approach people by mobile phone or email in future, different modes of administering the survey or sending reminders about the survey. But in order for us to explore the feasibility of that, we need to first look at how complete and accurate the data is that's held by trusts. So if you do submit a file without any mobile number or email address info included, we will come back to you and query that and double check that you have nothing on file. And okay, so there's sort of important notes on the inclusion criteria in terms of to confirm who to exclude. Deceased patients, outpatients. That means if somebody's been an outpatient and an inpatient, it's just the inpatient records that you would include and not the outpatient records. Patients without a confirmed diagnosis, or those given a holding code, indicating that they might be pending some results. Patients who are not aware of their diagnosis, patients aged 16 and above, when they were discharged from care. Private patients, so non-NHS patients, should be excluded. Those without a UK postal address, because that means we won't be mailing to people not outside of the UK. Please don't exclude those if addresses are incomplete. For example, if there's a missing postcode, we can use our systems to look up the postcode if we've got the rest of the address, so please do include those. This final point is important. It relates to the dissent process for this survey. So those that have informed your trust in response to viewing communications about this specific survey that they do not wish to take part, they should be excluded. A couple of things to be aware of. These were common sampling errors last year. Only include patients within the specified sampling frame of the year of 2021. Emergency and planned admissions should both be included. Do not remove duplicates. I won't dwell on that because I've already mentioned that earlier. And include all eligible patients, not just those who are newly diagnosed. Okay, I will pause there. In a moment, I'll pass to Philippa, who will talk through the process of submission. Before we move on, are there any questions about anything I've just talked about the sampling process or the eligibility criteria that you'd like to address?
There are a couple, Amy, that have come up in the chat.
Okay.
The first one is, what if there is if the ICD-03 codes aren't collected anymore?
The ICD-03 codes should be available. We've done a bit of exploration with Public Health England, and they should be available. This year it's exploratory because we don't fully understand until we ask for that data how complete that data is. So I think we'll just need to deal with it on a trust by trust basis. And if you're struggling to get that data, come to us and we'll have a conversation with you. I don't know, Pete, are you on the call? Sorry. I don't know if you've got anything to add, or any NHS England colleagues have anything to add to that.
It's Terry. I don't think Pete's on the call,
Terry.
but I don't have anything to add really. I think you're right that if people have difficulty with it, let's talk about it on a case-by-case basis.
Thanks, Terry.
There's another question which is regarding discharge dates. So discharge has caused a lot of discussion in Leeds in particular for patients who have SCT.
Sorry, it's Julie from Leeds. I just wanted to check, when you're talking about discharge, are you talking about an episode of care during the 1st of January to the 31st of December where they've been discharged?
Correct.
I think it's a bit confusing, to be honest.
Thank you. Is that, Julie, thanks for your feedback. Is that confusing in the way I've presented this or in the sampling instructions, or both? Because if it's the sampling instructions, we can of course
yeah, I think it's the other thing around if it is discharge. I think certainly children that are having stem cell transplants on as part of their treatment, issues and the way that they're seen can go on for a long period of time. So it caused quite a lot of debate around who would you include, who wouldn't you include.
Sure. It's essentially, yes, it is those discharge from inpatient or day case care. Julie, if there's any specific instances that you want to discuss with us, we can have a chat through those.
Okay. But you are talking about an episode of care, so they'll still be on treatment, receiving care. Yeah.
Yep. And it doesn't have to be a episode of care where treatment specifically for sort of active treatment administration, sort of care, any inpatient or day case care which is relating to cancer, their cancer should be included. Is that okay, or have I confused you more?
No, so I think if they're on active treatment but they're coming in for what we class as supportive care, then we would include those.
Correct.
I think it's when you're saying about outpatients, because our outpatients and daycare is all together. So
okay.
It's just being clear about, because that's, you know, a lot of patients potentially. I know it isn't compared to adults, but it's still quite a large sample.
Can you distinguish those the outpatients from the day case patients easily, Julie?
Yeah.
Okay. Yeah. So it's not the outpatients, it's the day case, and the supportive care. Yes, if that supportive care is provided by cancer team.
Yeah, that's fine. Thanks.
Fabulous.
And then there's just one, there's a comment as well from Leeds Teaching Hospitals regarding the timing for the data, so that the end of 2021 is a bit too recent, and that validation is not complete yet for some of that. So
Philip, thanks for your feedback. It's the same timeline as last year, and we did get a sample from your trust within the time frame. I don't know if I can open that up to everybody else to see if your views are similar. So Philip's saying that the data for the end of 2021 isn't complete yet. Philip, it would be useful to know what the sort of timeline is when that is likely to be completed. Is it sort of in the next month or so?
Hi.
Hello.
Probably, yes. I mean, obviously December is last month, and we haven't reported December data yet anywhere for cancer, certainly for cancer. The deadline for cancer waste, for example, for December isn't until the beginning of February. We're coming on to timelines in a bit, aren't we, in terms of when you want our sample. It just feels a little bit recent, considering the adult survey, for example, is patients between April and June discharge, and we don't submit it until September.
Sure. We want to get in field as soon as we can after the patients receive the care for sort of recall purposes, but we appreciate if things aren't ready yet, Philip, we can be we can keep in contact about that. The deadlines, Philippa will go over shortly, but it is February, at some point in February, the data submission deadlines. They're not fixed. If things aren't ready, us and NHS England can have a chat and look at amending those timelines and giving you another week or two if needed. Obviously, we'd rather have that data up to date, accurate and complete than not at all. So let's keep in touch about that. If those are concerns for others, feel free to pop in the chat as well, because
I think
it would be helpful feedback.
Things are a bit crazy at the moment as well, anyway, just because of COVID. So I think that's possibly something that's going to have an impact on all of our abilities to do anything at the moment, I'm afraid.
That's also really, really important feedback, and we welcome that feedback. And if people are struggling, let us know. We can adapt timelines. We don't want this to be an unnecessary burden, and we know there's a lot going on. So let's all keep in touch. We'll put the contact details up on the last slide, and do drop us an email or give us a call if you're concerned about the timeline. If when Philippa brings it up, you will have a big panic. We can have a discussion then. Sorry, Philippa.
There's also just a query from Charlotte regarding opt-out. So if a patient opts out and notifies PICA, is this an opt-out to all future surveys? And if so, do they as a trust get told?
If a patient opts out via the survey cover letter, Charlotte, that we send, they are opted out of all mailings from this survey only for this iteration. So they might be included in next year's survey, they might be included in a different survey, for example, the Children's Inpatient Survey, if that's running to a similar timeline. The Trust doesn't get informed specifically either of those. We just pull them out of the mailings and continue with the mailings as scheduled.
I think in the feedback, when they do select an opt-out as well, they are told by our teams that if they wish to opt out of other surveys, they need to contact the Trust directly to arrange that. And that's something that the Trust will keep a record of. Yeah,
that's a good point, Philippa. That's right. So patients are aware that they're only opting out of this specific survey for this specific year. Charlotte, hopefully that answers your question, but if it doesn't, feel free to come in.
There's another comment. Oh, sorry.
No, sorry, I was just going to say, no, that does. Thank you.
Thanks, Charlotte.
We've got a comment as well from Manchester University about the key contacts list. So I can take that up separately afterwards, and I'll reach out to you just to clarify exactly who that is, because it seems that there's a few people on there that need to be changed. So I can take that up after this. And just a couple of comments around the timescale that we've just discussed with Philip earlier on. So again, we will be running through that in a moment. So you can always drop us an email afterwards if you think for any reason that it's, you're going to struggle to get to us in time. I'm just looking at the final ones, and I think that's everything, Amy, for that section.
Brilliant. Thank you for your queries. Let's
oh, sorry, I've got a hand up. There's a hand up from Mary.
Mary.
At Great Ormond Street.
Sorry, yeah. I just wanted to query something, because I'm about to organize for the data sharing agreement for our data controller and the Trust to sign it. And the question would be, have we publicized this year's the survey for 2021 yet? So is there any new information that we can display and send out with our information to patients?
There is Mary, thanks for your question. There is a dissent poster which Philippa did circulate, and Philippa, maybe we can recirculate that after this webinar.
It's also on the website, so you can download it directly from there.
Okay, thank you. Yeah, it's just been Christmas break as well. A lot of things have not been read. Yeah, thank you.
Thank you. It's on the survey support materials page, Mary, which is now in the chat box. Thank you. Okay, thank you all for your questions. Feel free to keep them coming, and we'll have another question session after Philippa's talk. So Philippa, I will hand over to you. Thank you.
Thanks, Amy. I'll just bring up my slides. Can everybody see that?
Yeah.
Okay, perfect. So some of this we've touched on briefly before in Amy's section. So it's really about when you're submitting to us what you need to have in order to get the sample uploaded onto the website and to get all of that set up. So as we just talked about, the data sharing agreement has been sent out, as well as the patient list declaration form. Both of these will need to be updated and signed and sent to us via email. We will then run checks on the MAR end to check that we're happy with everything. And then once we have signed that off, you will be granted access to the online checker, which you should all already have a login for. If anybody doesn't, Tabby, who's working on this project with us, will get in touch with you with a login for that if you require it. So we can start taking the data sharing agreements now, and then, as Amy said, the declaration form will just need to be updated once you've run the sample and sent that through to us. So for this year, we are using the online sample checking tool. So a lot of you might have come across this before for the adult CPES project. So you will be sent access to this. This is where we ask that you submit the sample instead of the FTP site this year. So the login details will be sent out to you on completed receipt of the data sharing agreement and the declaration form, as we've said. There is a very helpful guide and FAQs button at the top of the dashboard, and this will talk you through how to use this checker basically in a step-by-step process in terms of uploading your sample. You'll need to use the sample template to do this. So again, that has been emailed out, but if anybody else requires it or it's not been received, again, that is on the Under 16s website, of which we've got the link to for the slides at the end of this. So you can get it there as well and download that. And you will just basically upload your sample here. So
Philippa, sorry.
Sorry.
Mary's got her hand up. I'm just checking it. It may still be raised from earlier, but I'm just checking. That's okay. I was just checking. There wasn't a key question now. Thanks, Mary. Okay. Sorry, Philippa.
That's all right. Okay, so once you have submitted your uploaded your sample, you will be submitted this on the home page. This will show any samples that you've sent in for other projects too, but there should be one showing for the Under 16s programme on here. It will then show as upload has queries. So it's very likely that the upload will have queries. Nearly all of them do that we see that come in, and most of them are very easy to resolve. So as you can see, it's kind of got the red button here on the data sharing screen, and you can see that it's got queries that need to be resolved. We can see that from our end too. So in order to resolve these queries, you will just need to select the icon in the actions column, which is just shown and highlighted here. It will then display the list of queries, which we've got at the bottom here. And there's a cog button next to each of these on the right hand side again, which is highlighted. And that will provide you with a full explanation of the query and how to basically resolve it. So we would ask when you're resolving the queries that you don't give a one-word response such as confirmed, because it doesn't give us enough to kind of go back on. So if you can provide more context to it, it's very much appreciated, and it will save a lot of time going back and forth in the long run. So types of queries that you will see once it's been submitted. The first type of query you'll see and probably come across is an error. This is when there's something fundamentally wrong with the sample. So if you have any errors in the sample, you will need to review the sample list, correct the errors, and then resubmit it as a whole sample again. So we can provide support with this in terms of addressing any of the errors, but we can't actually make the changes for you. So it will usually require a resubmit. The next type of query that you'll probably see is the check query. So these come up quite frequently. They may not be queries at all, but it's something that we just want to check with you. So they'll need to be double checked at your end to make sure that the data is correct. And if correct, you'll just need to provide an explanation for that query. So as I said, one-word responses aren't always that helpful in that area. So if you could give more context to it, that's very much appreciated. And if it is incorrect, you will need to resubmit the file again. So the errors and checks really should flag anything where there is anything that looks out of the ordinary or might mean there's an issue with the sample file as a whole. The next query that you'll probably have seen with adult CPES, if you have to deal with that, is the historical differences. So this query just flags if there's any changes greater than 5% compared to the previous year's data. So we are collecting that, and we have got that for last year's Under 16 CPES project. So you might have a few of these come up. We will be setting a caveat in terms of how big the difference will be at our end. So if there's anything that is alarming to you, please do reach out to us. But again, it will be set at a 5%, anything greater than 5%. So to tackle these queries and to review the differences, you'll just need to look at the CSV file on the page and then just provide an explanation if you're happy to accept those differences. And then the final one is notices. So these don't need to be actioned, but they simply show the information about your sample file. So how many patients have been presented, and it's a good sense check just from your end to make sure that it's kind of uploaded properly and it's as you expected it to appear. So mailing dates, we will be sending out mailing dates to trusts once they're confirmed. There is a time frame that we will be bringing up in the next couple of slides just to run through that with you. To put your mind at rest, we will be running a DBS check, which we do with NHS Digital, and this is run 24 hours before each survey mailing. So we have 3 lots of mailings. The first mailing goes out with the survey, and then there are 2 follow-up reminder mailings that go out, and we will run a DBS check 24 hours before each of those and remove any deceased patients from those mailing lists. Trusts are also very welcome to do a localised DBS check from before each mailing. So we will just ask when we reach out to you if you wish to do this, and we will make a note of that. If your trust does wish to do a local check beforehand, so maybe for local files that are more up to date than the NHS digital DBS check, we just ask that we have this 48 hours before the mailing date, because we run the national DBS check 24 hours beforehand. So we will reach out to you via email with a reminder for that beforehand, and just ask that it's to us 48 hours beforehand. Okay, so is everyone happy for me to move on, Amy, to sampling dates, or is there anything that we've got to cover from that section?
There's nothing that's come up. Has anybody got any queries about the sample submission process? No, I don't think so. Yeah.
So this is a timeline for the Under 16s 2021 survey. It's present in the survey handbook, which is online and has been sent out as well as the sampling instructions. So if you want to refer back to this and make a note of anything, it's available, fully available in both of those, which are on the website for anyone in the team that doesn't have access to that. We are running this sampling webinar today, and basically from today onwards we can start to receive any of your declaration forms or the data sharing agreements, and then we will grant you access to provide us the patient sample. We would welcome this. Obviously we touched on this a little bit earlier, but we're looking at the 4th of February as the last date to get the data sharing agreement, the declaration form and the patient sample submitted to us. That just allows us 2 weeks to kind of check everything and get back to the trust, as Amy said earlier, if we've got any issues with the sample or it might need to be rerun.
Can I, sorry, Philippa, to interrupt. That date of the 4th of Feb is just reflecting on what we spoke to Philip about earlier, and Philip saying early Feb was probably the earliest you can start looking at this. I just want to open it up. Is that 4th of Feb likely to be very challenging for people on this webinar?
Yeah, it seems quite a tight timeline, for, because there's some areas where the data has not been validated yet, so we'll probably need to wait for that before we collate. Okay. And for a trust as huge as ours, there's a lot to go through. So I don't know, the data collection teams on our site is here. I think Nick, 4th February is a little bit too tight, isn't it?
Thank you, Mary. There's a couple of comments coming up in the chat which fully agree. Terry and Nikki, can we pick this up perhaps tomorrow and see what we can do with regards to the timeline?
Yeah, so I think there was a precedent with the adult CPES when we were doing the sampling in the autumn last year. Because of COVID, people were struggling, so we did move, we extended the deadline by 2 weeks for that, and I think we can talk about whether to do that again for this one, what the impact on the survey would be when if we did that.
Thanks, Terry. Thanks everybody. That's really helpful feedback. We'll pick that up with NHS England colleagues tomorrow, and we'll be in touch as soon as possible with any revisions.
That's great. Thanks, what Philippa. I'll do then is I'll leave that out there. I won't go through any of the dates if they're going to maybe be revised, and it's something that we will, once we've picked that with NHS England, reach out to everybody on and maybe resubmit a different time frame if required.
Great, thanks, Philippa. The one thing we might want to just point out on the timeline is that the mailing dates, even in this timeline, are not confirmed, and we can't confirm the mailing dates until we have all trust samples signed off. But what we will do is we will email you those exact mailing dates as soon as we know what they are, so you can perform your relevant checks and know when patients will be contacted.
And we're looking to close the field work by June, so whether or not that's the end of June, maybe falling in July, again that will be confirmed. So we've got time now for some sampling questions. Does anybody have anything to ask about the sampling that we've run through today? If not, we do have some frequently asked questions that came up last year with the sampling that we did that Amy's going to run through with us now.
Thanks, Philippa. I'll just highlight one or two of the common FAQs that came up last year. If you do have any questions, pop them in the chat as I talk through. Again, these will be circulated afterwards. Philippa, would you mind if we stop recording just for the FAQ part, just to sort of open up for questions? Is that okay?
Yeah, I'll stop that now.
Great.